TMJ pain or popping, this process relieved 80 to 90% of pain and clicking. There was just a handful of people that I couldn't get rid of the clicking completely. On the affected side, you're going to grasp the teeth and you're going to pull down, forward, up, and then you kind of, the way I was taught, you're setting it back on, there's a little disc in there. So you're kind of tractioning that little ball and socket out and setting it back gently on the disc. And it doesn't look like much, so I'll show you. Firm grasp, pull down, forward, up, and push back. It's more like a stretch. And then I would just work the muscles. So this muscle everybody's familiar with. It actually goes from the cheekbone all the way down to the edge here. So you can kind of scan through that whole muscle, poke into sore spots, press. This is an acupoint as well, stomach 6, and it's used for PTSD. Think about the most traumatic thing that has happened while you find pain in there. And then there's muscles called the pterygoid. I was taught to try to get to them by going to the back of the mouth, going up and down behind the teeth and seeing if you can find some tenderness, and then under the jaw here too. You'll feel some tension, hold, and relax. And anytime we're doing muscle work, it's a good idea to stretch after, because the injury response in our central nervous system is to clench down like this. So we hit the injury spot and then stretch up to kind of release that tension in our system. And then the last muscle is the temporalis, which is along here. So I would actually work my way back and I would find little hard bumps in there, in that muscle. It's a thin sheet of muscle. I'd find some little nodules or bumps or whatever. But there'd almost always be, if somebody had a jaw problem, there'd almost always be a point that was like, oh, that's really, really, really tender. Like always, we're just looking for tenderness. Go all the way back to the end of the ear at least. And again, tender spot, and do the traction and relax. And in my experience, that resolved the vast majority of TMJ pain and clicking. And you can do it yourself.